Wonderful. So there we are. Welcome everyone. It's super exciting to be here for week 4 of Joint School Live. Time really does fly fast, even in these uncertain times, and we're all learning new tricks and picking up new skills and finding a way of living with these strange circumstances around us. And thank you everyone who's sent in feedback and questions and suggestions for topics to cover here on the Joint School Live classes. But also for those who are already out there using the Joint School app, and we're getting great feedback on the app and indeed on these classes too. So thanks very much for that. And if you have any questions or there's anything that was unclear in anything either in the app or that we've covered here, then please just let us know, and we'd be delighted to hear from anyone really. And one of the really common questions that we've been getting is around, well, a lot of it is how to manage pain and other symptoms at home, and particularly we've had quite a few questions around ice and applying how to best apply ice. So I'm delighted today to be joined by Andrea Hemingway, who's a very experienced physiotherapist with a lot of experience in looking after people both before and after orthopedic operations. And so I will unpin myself here so that we can see both of us on the screen. And welcome, Andrea.
Thank you, Dr. Axel, and good morning, everyone. Just to introduce myself, I'm a physio based up in the northwest of England, and I've been qualified over 20 years. I see a wide range of patients, and particularly I see a lot of patients with osteoarthritis, and we try to see them to help prevent and delay surgery, and also pre and post operatively as well. And one of the most useful and simple treatment options we have available for patients to be able to do at home is ice treatments, or sometimes that's called cryotherapy as well. And this is a cheap and easy option to do at home. And ice particularly helps reduce pain, as well as swelling and inflammation. And these are common symptoms of osteoarthritis, which is why it can be a really helpful treatment that you can do on a regular basis at home. However, with ice, you've got to be careful and use with care. There is the potential for ice burns, especially for people with delicate, thin areas of skin or areas of altered sensation. So just use it with a little bit of caution at all times. If you're using it for the first time, always check your skin regularly, and always follow the advice if you've been given any by your physio or consultant.
I guess as a bit of a default really is worth having a sort of a damp teeth towel or something in between a pack and the skin, generally speaking. I know you'll touch on some variations on that, but that.
Absolutely, and we've got one right here ready to use.
Fantastic. And what I'll do now then is I'll hop off the screen so that we can see all the pieces of kit and how to apply it and everything like that. So okay. it'll be just you from now on out.
All right. Okay, so the type of osteoarthritis best suited for ice treatment are more patients who suffer with hot, inflamed, swollen joints rather than just stiffness. And so that's the patients that probably get the most benefit from using ice. And the applications of using ice can vary from something that's quite low tech and cheap and simple to something much more higher tech. So we're going to start today with the basics, and what we've got is, first of all, one of the best options really is just a bag of straightforward frozen peas. And as an alternative to this, you could put some ice cubes into a plastic bag, but the frozen peas are best for moulding around a joint. They're more pliable and you get a better contact. And the evidence suggests it gets the tissues to the correct temperature for treating things like osteoarthritis. So what I suggest you do is get a damp tea towel and roll your peas up into that, ready to place over the limb. Say we're treating a knee, for instance. I would definitely want you to elevate the leg, because elevation is an important part of helping reduce swelling anyway. So put a cushion or a pillow under the joint and then mould the piece around the joint. Regularly checking underneath the skin, like I mentioned, and I'd leave those on for a good 10 minutes. In terms of other things you can be doing, certainly elevation is important, and if it was this was a real situation, what I'd be doing right now is lying flat so that my leg is elevated above the level of my heart. I'd also think that a good thing to do is to do some circle exercises with your foot. This is to help with circulation and help reduce swelling. So you can do that at the same time as you're doing your ice, if you wish. And you keep your ice pack on for 10 minutes, as I've said, but you can keep an eye on your skin whilst you're doing that. Okay, so I'll just pop that out the way for a second. And one of the alternatives to just regular frozen peas, like we have here today, is to get one of those blue gel ice packs. These reduce the temperature of the tissues a lot more than frozen peas do, and therefore there is the more potential for ice burns with using a gel pack. So you've got to use them with a bit more caution and care. Also, if you're using those, again, elevate the leg just as I showed you with the cushion. This is really important to get into good habits with post-operatively, because you tend to have a bit more swelling after, say, a knee replacement. So elevation is important, and also it's best to use ice after exercise, post-exercise, so that you can help undo any swelling that's or pain that's come as a consequence of doing your exercises. And then another option for a more focused treatment with ice, and something that you can do yourself at home very easily and cheaply, is to use ice cube massage. So to give you an idea what I mean by this, this is if you've got a specific area which is more painful in, say, your knee or any other orthopedic area. So, for instance, say I had joint line pain on the inside of my knee, which is quite common with osteoarthritis. I could grab one of my ice cubes and grab a piece of kitchen towel so that you can hold your ice cube in the kitchen towel like this, so that you're not holding it directly and sticking the ice to your fingers. So you can protect your fingers with the kitchen towel and then just work in circles all around the area that you want to treat locally. Towel under your leg, really important with this, because if not, you'll end up with a puddle. And keep the ice cube moving, working in circles all around that area. And you can really use this as long as till the ice cube melts, or for certainly a few minutes at a time. So I'm just working around this area, keeping it moving. And you can see my skin's going a little bit pink, but it shouldn't go anything more than that. And this kind of treatment is quite useful, not just for osteoarthritis, but for people with strains and sprains, ligament injuries. It can be used for those as well. Okay, so we shall just stop there at that point. It melts fairly swiftly. And so that's the ice cube massage, and it's a well-known treatment for osteoarthritis as well as ligament injuries. Another alternative, a useful alternative, is a device called a Cryo Cough. And this is a bucket that you fill with a combination of ice and water. It connects to a pipe and then to a sleeve that is specific to each and every joint. And the sleeve adds an element of compression, which is good for swelling. And that you use gravity to work with the bucket, and you empty the icy water down through the pipe into the sleeve. And so you've got that combination of compression and ice at the same time. And we found this a really useful treatment post-operatively. So it's perhaps a good investment to buy one pre-operatively so that you've had a practice, you've got used to using it, and you know what you're doing with it post-operatively. And we're going to have a picture of that for you to have a look at, linked in onto the film in a short while. And also, another more high-tech piece of kit that you could use is something that's used in professional sport with injuries quite a lot these days, and it's a machine called a Game Ready. And they are, again, combining ice therapy with compression therapy. And they're quite expensive to buy, but I do believe you can hire them. So this might be something you could use post-operatively. And you might want to try it pre-operatively as well. And again, we're going to link a picture of that for you to look at.
Yeah, absolutely. Yeah. So once we edit this video and put it back up on our YouTube channel, there'll be some nice, lovely images showing both the Cryo Cough, so you can see what that looks like, and the Game Ready. We are not sponsored by any of them, and neither are we sponsored by any frozen vegetable manufacturers and suppliers. So there's just kind of the range of commonly used things to apply cold therapy or ice therapy or cryotherapy, as it's sometimes called. Thank you, Andrea. That's a fantastic masterclass in applying ice to best effect. And you did raise the very important safety flags, as we always must. The main thing about avoiding an ice burn, and so for most things, have something in between. And of course, with the ice massage, the key there is that it's massage, so that the ice cubes kind of keep moving. Don't hold it in one place for too long. That's kind of the main. Oh, and also, as you well pointed out, which is a very important point about the sort of the blue. They're usually blue, sometimes green, but these gel packs, and that they can get significantly colder than a bag of frozen peas, and so they should be used with extra caution.
Yeah, yeah.
Super. And then I guess also sort of as a bit of a counterpoint and perhaps an opening for another masterclass is that warmth can also be helpful in some cases, and I guess that can feel a little bit counterintuitive to some people, that both ice and warmth can help. But I think that's something that people can try, and you'll find what works best for you. And there might be different types of pain and different scenarios that help. But perhaps more on that in another session.
Yeah, and certainly I find that patients find what suits them best and their symptoms best. So warmth can help. And the other alternative is to use a combination of ice and cold, ice and heat, and alternate between the two. So some people find a mixture works well for them as well.
Yeah, absolutely. Well, more on that to follow. Thank you so much, Andrea. And to everyone else out there, be well. And yeah, we'll see you in the next video. All the best.